Oh, wait, hit pause. Tonight it is not going to be me introducing this webinar or teaching you tonight. We have a very special guest, Simone Fortier. I believe that's French, I'm not sure, who is an incredible educator, fascia specialist. I will not be teaching because my daughter's with me, but I'm going to allow Simone to take the floor. As with all of our webinars, they are recorded. They will last about 45 minutes from an educational perspective, and then time for Q&A. So if you have any questions as Simone is going through that content, type out those questions in the Q&A or in the chat box, and she will make sure that she answers those. And then again, this is recorded, so you will find this emailed to everyone as well on the EBFA YouTube channel. Simone, thank you so much, and I'm going to pass it over to you.
Awesome. Well, thank you, Dr. Emily, for having me here to share and really support those who are fascinated with fascia. And tonight we're really looking at fascia and how it affects movement and performance and pain. So it is the missing link to changing mobility and reduce pain. So keeping your edge, if you're not in pain and you're an athlete or a weekend warrior, keeping your edge, the concept of fascia and movement. So when I look at this, it's like this, oftentimes people excel or they're exceptional or they hit a ceiling, and there's just that one missing link, and it could be hidden in the fascia. So always keep in mind that every modality has its place, and the tools are amazing. Practitioners really invest in supporting you as an athlete or as a practitioner yourself to really reach the next level. So the fascia, I'm coming from the perspective of a holistic view of your entire being. So what does that really mean, and how does it affect movement? And I'm going to try and keep it as condensed as possible because I could go on for days about fascia. So again, welcome. Thank you for sharing your time with me this evening. I know everyone's busy, but aging won't wait. Prevention starts now. And as a practitioner, a parent, or a person, fascia influences every movement, breath, and thought. Right now, as you are sitting there or standing, it's really due to the fascial fabric. And going into how does that affect really mobility, motility, balance, strength, and performance. And it really starts with creating space inside the body. So an outline for tonight, we've got a lot to cover. What is your why? Why are you here? What do you want to learn about fascia? Because some of you might be experts in fascia already. So just maybe one new thing that you can learn, or those that are new to fascia. What does it really mean to you as a non-practitioner or as an athlete to affect really your performance? Fascia defined, my definition is a little bit different. Who am I? What makes me a fascia expert? The fascia versus muscle model, going into that as much as possible, because it seems like people always go back to the muscle model, because that is what's really ingrained in us in school and education, is to segment our bodies. Examples, fascia theory of the Fascia Training Institute philosophy. Can fascia stretch? That is a controversial topic that people are talking about all the time. So we're going to go look at that. The fascia assessment. So in the chat, I would like a volunteer. So if somebody would like to volunteer in the chat, because I would like to be able to do a live assessment of fascia. While we're here on the talk, we'll have time for that, and some takeaways really for everyone when looking at the fascia globally and what that means to that person. So 3 fascia movements, tempo and timing, and how you can work with me and training. So we're going to get into that right now because there's a lot to cover. So what is fascia? Fascia has become a term that is overused and not fully understood. Every time you touch the body, you directly or indirectly affect fascia. So for lasting and long-term results, we really want to create lasting change with direct movements. Indirect movements come from really any sort of stretching, yoga, unless there's a lot of intention and engaging the fascia and being present. So also too, ART indirectly affects the fascia. So if it's not a fascial injury and it's just a tendon thing, ART works well. So you can switch on reflexes, but it may not systemically affect the fascia. So again, direct treatment, direct intention is really what creates lasting change in the fascia. But every time you touch the body, yes, you affect the fascia. So tonight the focus is to shine a little light into a structure with so much attention. And why is movement essential to a healthy body? Again, going over, what is your why tonight? What do you want to learn? In my courses and classes, I always start off the class that way, because again, with the brain and with fascias, things change. We don't realize where we came from. So always keeping track, keeping a record. What is your why? Why is fascia important to you? Why is movement important to you? What's your goal tonight? And how does fascia influence your pain and your mind? We're going to delve into that and how it does, and how I can help support you in understanding what that is. A little about me. I was born with an ability to listen to the body on several levels, seeing in between from the inside out. The first time I touched the body, I instantly had an affinity with fascia. This is after doing manual therapy, physical therapy, and the lymphatic system. So I put that in there. So yeah, I had an affinity with fascia and lymphatic without even knowing it until I studied it further. Why am I getting lasting results? Why can I do this work without pain? Well, how can I do it as a practitioner without aging my body? All of that was coming with my philosophy of finesse versus force. This led me on a long journey in the study of fascia to teaching the experience of fascia. Yes, the experience of fascia. So when we look at modalities, and here's an example of this, how do you know if you've had a fascia treatment or a muscle therapy? So when we're addressing the fascia, the person has an experience in the sense they're like, the change is occurring from the inside out. We're not actually doing it to you. We're creating space. And how we do that is by directly influencing the direction of the fascia and by releasing muscle fibers. So we can do that through movement, through micro stretching, as well as manual hands-on stretching. So if you get a fascia treatment, this is how you know as a practitioner or as just a general person who wants to get a fascia treatment. This is really how you tell whether it's fascia or muscle. A fascia treatment or fascia stretching, you can feel relaxed. If you feel relaxed, just relaxed, then you got a massage, which is primarily muscular work. So some people say they're doing fascial stretching or deep fascial work, but if you just come out relaxed, and also too, if the treatment is symmetrical, meaning they do the same thing on both sides of your body, that's a muscle model. The fascia model is not that way. It is asymmetrical because our fascia, because of life, isn't symmetrical. So we have to look at the lines of tension in the fascia, how we stretch, how we work out may not be symmetrical until the fascia becomes balanced. So when people experience fascia released from the Fascia Training Institute or any of my students, the first thing that comes out of their mouth is what just happened to me. I have no words for it. It was an experience. And also too, the treatment goes by like an hour, hour and a half, like 5 minutes. It's like, wow, the time just evaporates because that's when you're truly present. You're dealing with the fascia and the unconscious mind, which is the body, and the body is the one really in control, your inner physician, of how you heal. So we're just nudging you to really heal yourself. So that's a different philosophy rather than forcing things to change. From that experience, from the body, the inner physician healing, pain is resolved. And results speak for themselves. Creating space starts from the inside out. So the whole perspective on fascia for me is really creating space inside the body. So I'm going to do this. This is just an example of this, but I'm going to go back here. So when I move to one side, the fascia allows for space for the organs to actually glide and move in the opposite direction. So if there's adhesion, stickiness, because fascia forms to what we do the most, that movement is restricted. Restricted movement creates pain. So that's why movement and mobility is so important, especially in a culture where we sit for anywhere from 10 to 12 hours a day. I'm standing now, I stand most of the time when I teach, when I'm working with people, because in movement, you're laying down new fascial fibers and tearing apart other fibers that no longer serve you. So go here. Okay, so real life example. I had a man who was referred to me. He was and it still is an airline pilot. He does all the flight simulations, a motocross maniac, avid sports person who teaches and does flight simulation training. He was referred to me after his doctor said his debilitating pain after 8 months might be coming from the fascia. So I really like that conversation, and that the medical community, other practitioners are going, okay, that's not my lane, but this might be the problem because it's chronic, ongoing. And he had been getting countless treatments with physical therapy, ice heat stim, IMS, chiropractic, ART, massage, and FSD. This man was doing it all. 8 months later, he was referred to me because his doctor said fascia. He was telling his friends about that. He came to me, and really, how is it different? And this is looking at globally what's happening. So I always teach, do the fascial assessment. Other practitioners are excellent. All the people that he saw were treating muscle disorders, which if that was his issue, he wouldn't have chronic pain. So, but focusing on that pain in the neck, the shoulder pain that man was experiencing, they missed out on really directly affecting the fascia. So the FDI approach, we take out the biggest lines of tension after doing a fascial assessment, and then looking at the fascial work is not symmetrical. So muscle therapy is, again, I keep re-imprinting this because it is a different language, and I often say it's opposite day. So everyone who has studied the muscle model and that sort of thing, it's like a relearning is taking place, even with the person who has, Dr. Google and also anatomy background. It is kind of reversing what they've learned. Not that what they've learned is wrong. It's when we're looking at chronic long-term pain that affects our quality of life, that all these other modalities haven't been able to create lasting change. We need to look at the missing link, which is the fascia. So from this gentleman, I didn't hear from him until he wanted to book another appointment. So this is really cool. With people like this, the change is pretty significant. So they don't need multiple appointments. Really, their self-care and all that sort of thing can keep them moving forward. But he called me and he said he'd like to come in. And he could not believe that one treatment could resolve 80% of his pain. And he goes, I can't believe it. And so again, if he had underlying issues for years and years and years, it may take longer. But if we, again, do the fascial assessment, look at where the biggest lines are, take those out, and then treat that, and then give exercises for that, the results are there. And so the two biggest things is, one, people want you to treat the symptom. So what I explain to them is that all these other people who are exceptional at what they do treated the symptom. It didn't work. We might want to try a different way of looking at what's causing that pain. So most people agree with that, but still they have that mindset, the pain, let's focus on that. And we don't really want to focus on the pain. We want to focus on the cause. So how is this different? The concepts of fascia, stop chasing pain, and symptoms, look at lines of tension. I teach a symptom based on concepts that can be applied to any injury, pain, or I don't know the word there. A retired podiatrist actually reached out to me, which Dr. Emily might think is interesting. He just reached out to me on LinkedIn, and he was interested in saying, okay, he was selling laser, and his type of laser was just amazing for helping with physical injuries. And he then started saying, oh, this would complement a full body fascia treatment. So I'm like, well, there is no real full body treatment. That's massage. That's the massage model. FTI does look at the entire fascial fabric and what's causing this dysfunction. Dr. David shared that he was taught to think of a cause as an abnormal foot function and biomechanics. And that is absolutely correct. But when people don't have the response that you want with that assessment and with the tools that you're giving, let's say, for example, from Dr. Emily, then we look at, okay, there's something global, there's something bigger. Because if it's just that region and there's just an issue there, then yes, all those things work. And that's usually 90% of the population, those modalities work with, but it's really the 5%. And when I'm dealing with concussion, it's the 20% that don't recover. So it's looking at a smaller population, but to them, the pain is quite big. So my response to Dr. David was, yes, what causes abnormal foot function, it does not happen in isolation. It happens in my experience because of the lines of tension in the fascia from injuries, posture, and so on, which alter biochemical load, force, creating dysfunction. So if you have these lines of tension in your fascia, it does affect your gait. And if you change the gait without affecting those lines of tension, eventually that correction will not hold. And we really want that correction to hold. So working with the fascia and doing the modalities, other modalities for the foot and over the back and whatever, they work together in harmony. One is dealing with the holistic view, the other one is very specific. So I like working with both because, again, it creates lasting results and pain-free. So his reply really to my reply was, this is a multifunctional etiology. Let's break this down. Pertaining to arising through the action of many factors. In genetics, arising from the interaction of several genes, or the study of causes of origin, the branch of medicine that deals with the causes or the origin of disease. So that's really my mindset when working with the fascia. Let's look at the origin of the dysfunction. So was the foot causing the lines of tension in the fascia, or was another injury causing the lines of tension, causing issues with your foot? So again, making out what is doing that, and doing the fascial assessment is kind of the secret sauce to looking at what's causing that. And then as a practitioner or as just a regular person, doing movements to release those lines of tension, which we'll get to later today. So going into the FTI philosophy, we always focus on the origin of pain, movement, restrictions, and which cause premature aging of the body. So stress inside the body creates wrinkles, but it also creates lines of tension in the fascia, and the fascia becomes thicker, goes from mobile flowing to glue-like to then like cement. So really we want that flowing inside the body, wants space. So our brains are like, okay, what does that look like? So inside the body, there's more space than stuff. So we want that space to allow for gliding and smooth moving over organs and structure so that everything is not sticky on each other. So fascia is influenced by every thought, movement, or lack of movement. Fascia communicates faster to the brain than the nervous system. Fascia has no beginning and no end. The extracellular matrix is comprised of collagen, elastin, glycoproteins, and this is the microcomponent of your body where cells are created, destroyed, and recreated. So fascial fibers, when they're formed, they come together, come apart. When we move, they're coming together, moving apart all the time. When we don't move, the fascial fibers get thicker, thicker, and thicker until we can't move. So again, movement and mobility is so important. A deeper look into the fascia, we can look at the laminin, which is a glycoprotein from basement membranes. Any family of glycoproteins located in basement membranes provide structural support and promote cell growth and regeneration. Let's start talking about fascia and how it influences movements. So I'm going to go back with these glycoproteins. So when the sperm and egg come together, fascia is formed. How you look today, your structure, how you are upright is because of fascia. It protects, corrects, and again, provides space. So the fascia really In my experience and my philosophy is that it's where if you believe in the soul is housed there, the spirit, the personality is actually in between all the spaces in the body. And the fascia just creates that space to hold everything together, which is really fascinating. And to look inside the body at the fascia, it's a work of art. Everything is always in motion and moving, which is indicative of us always being in movement and motion. So can you stretch your fascia? It's not a simple answer. Technically, elastin fibers are in the fascia. So yes, there is pliability. So with the fascia, it is pliable in certain directions and not in others. But that flexibility is quite minimal. So technically, yes, you can stretch your fascia when you're doing direct techniques. But really, again, what we're looking at is breaking down fibers and recreating fibers to allow for space. So the fascia, I don't call it stretching, I call it spacing. So it's a whole different terminology. And looking at really how to create more space is via movement. So breaking down those old threads. An example that this is happening more and more now because people are looking down at their phones and their computers. So always optimally keep your eyes in the center of your screen, which means if you have your phone, really it should be here. And that appears to some people to be rude, but it's no less rude than looking down and into your pocket. So again, for our health, longevity, this is happening. Actually, one of my students who was helping me out, he was 21 years old and he had a Downinger hump that was probably about 3 to 4 centimeters or 2.5 inches. And because we did the lines of tension, took pictures, looked at his fascia, and he's like, oh my gosh. So he really has the body, a 21-year-old, of a 65-year-old. I have 8 and 10-year-olds coming in now who have the bodies of 45-year-olds. So that's affecting not only their fascia, their nervous system, their learning, their visual field, their proprioception, because all the time they're looking down. So again, that hump there, traditionally doctors used to say that was fat, but that's actually fascia. So that fascia keeps getting thicker and thicker to actually hold your head up. So eventually your head's so translated forward that the thickness is there, and that's really, you have no movement, so you can't even bring your head upright. So the forward head position alters function, the nervous system, your breath. It actually affects swallowing, digestion, because you lose space here. So again, digestion starts here. So eventually people will choke or on food, they won't be able to swallow food, and then they might get acid reflux. So again, the fascia here, this restriction, can create acid reflux symptoms. So again, we can release that without going on medication to, again, promote digestion. So going back to how the fascia affects form. Again, the forward head position certainly affects the heel striking force on the foot and gait. And if you are looking down and looking forward, you're more prone to falling. And if I tapped you on the back, again, you're more prone to fall forward because your center of gravity is in front of yourself. So this is an excellent example of fascial fibers laying down and getting thicker and thicker. This can happen anywhere in the body, again, depending on how we sit. If we sit to one side, then there's a thickening of the fascia there, and there's more space on the other side. So the purpose is really to hold your head up, your fascia, and your fascia really forms to what you do the most. So again, thinking about what do you do the most? If you move, then you have more fluidity, less pain. If you sit, it becomes more compressed, more restriction, which affects function. So now it's time to actually stand up and move. So in classes and even in webinars, people like to sit there and they get comfortable and they get relaxed. And oftentimes they collapse, especially if they have some hypermobility. And it takes a lot more effort to actually move your body. So looking at hypermobile people, sometimes they can appear lazy because they have to engage their brain, their joints, and their fascia and their muscles, because really all those the muscles and the fascia are doing the work of their ligaments. So that hypermobility can affect really energy. So I want everyone to really stand up and take a stretch. So we're going to get a live person. So I'm going to look in the chats here and see if anyone volunteered. Oh, I have a volunteer, Laurel. All right, so how will I see Laurel? Let's see if I can do this here. I might not be able to see Laurel. I didn't think about that. Okay, so Laurel, actually, if you would like to, a new message, let's see. Okay, so let me see here if I can do that. Okay, so I think I can come in here and find you. There you are. All right, there's Laurel. Hi, Laurel. Nice to meet you. Hi. So I'm going to ask you, so we're going to do, have you ever had a fascial assessment?
I don't think, well, I haven't had somebody talked about it. I had a chiropractor who did myofascial release chiropractic stuff, and he was amazing.
Awesome. So what was that for?
Well, I'm an ultra runner, and I was having all kinds of foot issues. I was working on being a barefoot kind of person, and I was having some foot issues and whatever. So he did some amazing work, and I did 100 miles in minimal shoes. So that was like, it worked. But unfortunately he died. So now I have to figure out how to do it myself.
Okay. And so how are you feeling right now? How's your body feeling? Does it feel light or heavy?
Kind of in between. I'm psyched for this. So it's kind of up that way, but I've also, I had a fall in February and I banged my knee and it kind of got everything out of whack. And I'm kind of, I'm trying to rehab that and as long as my form is perfect, it's okay. But other than that, I get problems, and it does. It starts in the knee and then it ends up in my foot.
Right. So that is a very, I'm glad you brought that up. So what you said there, you have to have perfect form because there's instabilities. So when you have instability in the system, you have to be totally mindful or eventually you're going to have an injury. So you have to stay present. So that actually is exhausting for the person long term. And as soon as you get tired and fatigued, which happens when you're training or working out, you're going to have an injury. So that's why dealing with the fascia, we remove that instability and create stability in the system so that you don't have to consciously think about it, because people aren't present all the time. And as soon as you do that one last rep, that one last run, all that sort of thing, then an injury happens. So Laurel, can you actually stand up and walk back a little bit so I can take a look at you? Because what I see right now from really here up is that Laurel needs hydration. So water is really important. Yes, so take a sip of water, please. Yes, water is really important to fascia. So if you're dehydrated in the smallest amount, the fascia will be painful. So it's almost instantly you take a sip and the fascia actually and the muscles absorb it. It's really amazing. So you have a sweatshirt. I'm going to ask you to move to your left, which is the opposite of the way I'm pointing. Yeah, if you can. Yeah, perfect. And I'm going to get you to turn and look to your left. Yeah, so face your left. Yep, turn and face that direction. Don't face me. Yep, look that way. So these are very small. Oh, so what I'm seeing right now, I don't have a full body picture, but I saw this when you were sitting there. You actually have lost the curvature in your neck. So you do have the forward head position. And you have actually a thickening over the trapezius, which again is affecting circulation to your head. So even standing there, so face that forward, I'm going to talk to everyone about you while you're looking that way. And thank you for volunteering. So what I call it too, I can't see Laurel's ankles, but what I'm going to assume is that her center of gravity is in front of herself, and her ankle, her hip, and her shoulder are not in alignment. And really, her fascia is quite thick, which means her lymphatics is congested. So I can see that. That's why I said you needed water. And so just from standing there, I want you to raise your hands above your head. Okay, and look forward, look straight ahead. Okay, and I want you to bring your hands up even further up towards the ceiling. Can you do that? No, she can't do that because there's no space. Yeah, that's a struggle for her. And she's putting her head forward. So that whole front fascial line and the side fascial lines, the lateral line, are very restricted. Bring your arms down. And how did that feel, putting your arms up over your head? Yeah, not as easy as it should be.
Yeah, I kind of, I mean, it was easy to go to here, but when I tried to go further, I could feel it like right here.
Right, in her, so those fascial lines is in what's happening. She's restricted space. You can come sit down. And because just really, I don't have to see the entire body because I can tell really from the fascia from here up, which looking at Mitch Tobreski here, we just really did fascial work on cervically up, which changed his entire symmetry in his body and also his head position. So with that, you can learn where the epicenter is, the root cause. And so for that, for you, it's a big fascial pull forward. So the running, you're already forward and then you go to run. That's going to create hamstring issues. Your hamstrings are continually going to be in spasm to bring you upright. So your quads are engaged, but fascially you're being pulled forward. So your hamstrings are always contracted. So people want to go, oh, I want to stretch my hamstring. I need to stretch my hamstring. You stretch your hamstring and then you're being pulled more forward because your fascia hasn't been released in the front. So it's creating this constant battle between the muscles and the fascia will always win. So the first thing that's really important is going to be one of these stretch movements that I'm going to show everybody coming up after this, because it's one of the most important stretches, one for your feet, plantar fasciitis, but also for the forward lean. So everyone, when they're working with calves, they want to do the calf stretch traditionally by, putting the heel down, doing the stair exercise. Well, this is the opposite of that. So we're going to do that one. And that's going to be hugely important for you. And also too, I would suggest that every time you are in your car, to put your head against the headrest. So that may take actually 2 to 3 weeks for you to do that. And then once you reach that, so again, it's from here, you want to, right here, you want to press against the headrest with your chin up, and you do that for 4 to 5 seconds and then release. And you'll do that for a couple times, then you'll be exhausted. Then when you're getting back in the car again, you can do it again. And that will take probably a couple months for you to do. And then once you do that, then we're going to get your shoulders against the seat. So you're driving like this. And everyone that I pass nowadays is driving like that, no matter what their age. So again, that ages your whole system, but also people look at that and you look 10 years older. So just by opening up that space and creating that space actually de-ages you because you're upright. And so also too with fascia, when we're really restricted down like this, we get a muffin top. You create space, there's no muffin top. So that's pretty motivating for a lot of people too. It's just that simpleness. But when you open up the fascia, not the muscle, because the muscle can really only engage for really 10 to 15 seconds. Then you're back doing the same thing. So we really want to open up the front for you. And also too, when you're walking, I want you to bring your arms up over your head. while you're walking. Every couple steps, do that for about 30 steps because you've lost the ability. So what people are doing, and this happens in golf, so sorry, my hair's there. So you can see people are like this and their arms go like that. So they think it's up. So again, we come upright, arms come up, and the chin is up. Yes. So with that, I can see there is also a shoulder injury or an old shoulder thing there too in your right shoulder. So that creates lines of tension. So every movement that you do, again, I can do this. That's all joint, that's not fascia. So the fascia, again, you want to stay engaged. You want to bring your arms up, make sure your chin's in the right position and lift. You want to lift without tilting up. So you want to look straight ahead. Yes. So that's harder for you to do. Yeah.
Simone, real quick, people cannot see the video, so
Oh, they can?
let's pin it. But for the sake of time and the fluidity of the webinar, if you can just mimic on the video right now in your posture, the way that Laurel's posture was, so that all the listeners can see what you were seeing, but you will have to mimic versus trying to pin Laurel.
I'm very good at that. So with Laura, when she's sitting here, her shoulders are like that, her head is forward. So when she went to stand up, her body was like this. So can you see that? Very pulled forward. So there was no stacking. And by doing this movement, her arms were like this. So that's saying there's all lines of tension in the fascia that we want to release. And just by doing certain movements, again, we're going to stretch the fascial line. And then the movement of just putting her arms over her head and lifting her chin will help release the fascia. But again, people don't do that very often because we're always looking down and eventually we lose that ability. So again, thank you, Laura, for being a demo. I apologize that people can't see that because I can see it perfectly. So hopefully in the replay, people can see that and maybe not live. Okay, cool, awesome. Okay, so I'm going to answer these questions in a minute because we're looking at the fascial assessment. So we're looking at lines of tension. And so for that, we just want to look at the biggest ones. Where's our biggest line of tension? What's causing the pain instead of really where the pain is. So the tangible fascial movements and fascial assessment live example, which we just did, we take out the biggest lines of tension. So what do you see? We all see from the modality that we're trained in. So if untrained, you will always look at your face and miss out on the lines of tension in the fascia. So just be aware of that. I don't look at a hip hike, a shoulder hike. I look at lines of tension. So where is that pulling? Where is that? It could even be from an organ, it could be from the shoulder, it could be just your center of gravity's off. So it's looking at globally what's going on in the body. So there's 3 movements that we're going to do. I'm going to see if I can move this. So can everyone see the picture here? I'll go back up. So 3 movements to release the fascia. The tempo, how you stretch matter, how you move matters with fascia opening, spacing, or stretching. You need to stay present, stay engaged, and activated. You cannot collapse into a movement or a stretch. So one of my favorites is to stretch the top of the foot. This releases the calf and plantar fasciae. So this is really great for runners. And as you can see here, Claire is one of my hockey players, but it is the top of her foot. So she's with her right arm reaching towards the ceiling. But for most people, it's so restricted here, they actually want to hold on to the wall or a chair. So I can do that, because I'm looking at the time. I can do that right here. I'll take my shoe off just to show you live how that looks. Because this is one of my favorite, let's see if you can see me. So the top of my foot. So hanging on to the chair, because again, we want to be in perfect alignment, chin up, looking straight ahead, and then putting the pressure on the top of the foot. This actually is one of the most important stretches. Hopefully you can see that. Important stretches really for the front fascial line. It stretches all the way up the body. And then as it gets easier, you just reach towards the ceiling. So this one, you cannot do it often enough, but it seems like because of our shoes and our always looking down, it shortens that front fascial line. So again, this image with Claire doing that picture and then holding. So the secret to movement and mobility and to opening up the fascia, the first time you do it, you're just really signaling to the body that something's happening. By the second time, the fascial fibers are opening up. By the third time, it's actually creating space. So the first time, this can be really excruciating for people, especially if they have really restricted fascia in their foot. The second one is the side stretch. So I have this picture here, specifically because this is not what we want to do. This is stretching, it feels good, but to stretch the fascia, we have to anchor. And to anchor the hip, to do that, again, let's see if we can see me doing this here. So coming back here, you won't see my head because the most important, my shoes aren't even. So most important part to anchor is hip out without shoulders doing this. We don't want that. That's collapsing on our spine. So hip out, shoulder goes up, and you reach towards the ceiling. And then you really feel that side and lateral fascial line. So the secret to this one is hip goes out and anchors, and then we reach up towards the ceiling and chin up. We want that space there. We don't want to tuck our chin down. And there is different philosophies with that, and I will explain that when I go through the questions in the chat. But this one, the side fascia, the front fascia, the side fascia are extremely important really for mobility and freeing up the whole thoracic. So if your thoracic region fascia is restricted, you will most likely have foot issues and back pain. So again, it is related to what's going on in your foot, but that's one of my favorite ones to do too. So also this one, this here is using you can use a ball. You can actually just sit there and do the same thing, reach up and back, because again, we're creating that space in the front fascial line. So this actually releases muscle spasm in your rhomboids. So again, we're looking at the muscles. So people are like, oh, my rhomboids are tight. So a lot of therapists will go and treat and release the rhomboid, which is a muscle. So they release that, the fascia actually gets tighter in the front. And again, the spasm returns. So that's because of posture, the forward head position. The rhomboids are working 24/7 and they need a break, but they never get it. So the rhomboids are always tight and there's spasm there. But really the secret is to open up the front, and then the rhomboids don't have to work 24/7. So that's also the same with the hamstrings. We want to stretch the front fascial line for the quads. But we start with the foot, because the foot actually, that people can feel that all the way up actually into their jaw. So those are the three fascial assessment movements. And again, they're static here, and on a Zoom, it's kind of hard to show everything exactly. So I thank you for understanding, and I apologize for not seeing Laurel, but hopefully in the replay, she's there and you can see it. So again, the three fascial movements are really important. I'm going to go back. The top of the foot, the side stretch, always anchor your hip. If you just do the whole body, that's more of a joint movement, and it looks really good because again, there's some grace there, but we really want to stretch the fascia. So she's stretching muscle. We want to stretch the fascia. So it's very specific in how the movements do. This one here will actually open up the whole front fascial line, but release the rhomboids. So just to say, I have some upcoming courses. If you want to work with me live and in person, they're here. They will be in the replay as well. And again, if you want more information, I have online courses that can support you in doing the movements. So it takes a community. As a therapist, a practitioner, it's always optimal to create a community to stay accountable, level up, and be a resource for those clients and athletes that are the exception and need additional support. So, just really partnering with people, like I'm partnering with Dr. Emily. She's supporting me with sharing my love of fascia to you guys. And yes, we have a upcoming seminar coming up in the fall. And yeah, we're going to be sharing our expertise with you guys in person, which I'm so excited to do. So I'm going to get to some questions. Let's see. Okay. So I don't see me. No, I see Laura. Okay. Go to the top. Oh, there's lots. Great. Okay. All right. So there were a question before. Okay, so I'm going to just start with some of these. Some of the seats in cars encourage head forward and rounded spine. They do for many different reasons. Because for really insurance purposes, so they want that forward head position because people's heads are forward, and so there's little space to come back. So again, they're looking at the cost effectiveness for insurance claims and whiplash. So again, people's head will go forward and come back regardless, but they're looking at really reducing that space. So it isn't optimal. You can actually, this comes up a lot, you can go to the dealership and get a different headrest and put that in. So that is important because we do not want a rounded spine and we do not want our head forward. So from Linda, when lifting the chin, do you mean bringing the crown of the head in line over the ears or the shoulder as opposed to tipping the chin up? Yes. So because everyone, well, I'm generalizing, mostly people are looking down and they've lost that space here. So I just want it back to neutral. So it's just really a tipping. It's not but most people will do this. I'm going to show this movement because they lack the ability and mobility in their neck just to lift their chin to neutral and then translate it back. So we really want that alignment from the ear over the shoulder. So that's a great question because, and a lot of people saying, oh, my physio is telling me to keep my chin down. Well, that's for a movement and an exercise. But we really want the fascia as opened up as possible to allow for movement and less point of injury. So with the top of this is from Emily, with the top of the foot release, do you reach the opposite arm up? Great question. Can you explain how that side stretch as pictured stretches muscles and not fascia? It seems like it would stretch both. It is to do with the vertical directionality. So first the top of the foot, you can do the opposite side. That's more balance. For the fascial line, we want to do the same side. So you want a bigger stretch on the same fascial line that's restricted. So that's why we do the same side, the top of the foot and the same arm. Then we switch and then we do the other foot. So we want to do the same side. So if we do the opposite, so the left arm, right top of the foot, that is a brain exercise actually, and a muscle and balance. So with people who have concussion, that's quite complex. So the more complex it is, we can't start there. So with the fascia, we want to start where there's some success and build upon that. So can you explain how the side stretch as pictured stretches muscles? So it stretches muscles and joint. So she's collapsing into the stretch. So when you're dealing with fascia, you stay upright, lifted, and engaged. So if I'm engaged like this, there is no way I can collapse and do that. So that's muscle and joint. So if I'm engaged with the fascia, the movement is intentional, slow, and the range is different as we're opening up the fascia. So again, it is very specific, and the tempo and timing is really essential to engaging the fascia. So with some yoga practices, they really get to the intention of that. And you can actually feel the fascia opening and burning, tearing, ripping feeling. That's when you know it's fascia for some people. But when you collapse in, it's muscle and joint. And people who have hypermobility love to do that, and they love to do yoga. And some cars, you can lift the head rest up and turn it around, which is perfect. Excellent. So can you say more about tempo and timing for fascia opening and focus? So I think I did that a little bit right now, but going into the tempo. So here's a muscle stretch. Here's a joint stretch. So with the fascia, I want to start off, okay, so I'm starting to engage my fingers, they're reaching forward. So again, the movement and the tempo is really slow. So if I dislocate my shoulder and I start using joint, you see a floppiness, that it's lost the engagement of the fascia. So we want to engage, 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 which means not hyperextending or dislocating the shoulder joint. It's engaged and up, and the tempo is quite different. So then we reach over, reach, and then really, okay, the range is quite different. I could go into muscle, and then I go all the way over. And with that, we could then do fascial stretching over really the lateral region over the psoas. So again, it depends on what we're stretching and where people are most restricted. So we look at the lines of tension there. On some cars, I have an old Toyota. You just put your computer on a box and to raise it, absolutely, that's awesome. So sorry about Laura, there's lots of things there. So how do I identify dehydration visually? When I first introduced myself, I have the ability to really see the body from the inside out, but there is a texture. So when I look at people, there's a texture and there's lymphatic congestion. So she definitely had such fascial restriction over her neck and her shoulders that would affect really lymphatic flow, but also too, I could see that, really she's not optimally drinking a gallon of water, depending on where you live, sipping per day. And so you can see that in the fascia quality, in the skin quality, and also to circulation. So the more water you have, the more vibrancy that you have in the skin quality, which then really reflects directly what the fascia is doing. So skin and fascia aren't the same, but the skin really is the last line to say, okay, there's dehydration there. And you can also look at the coloring, and the coloring goes into really circulation. So the more hydration we have, the better circulation as well. So yeah, I can tell people that. And too, when I'm working with them, I just touch the fascia and I'm like, okay, yeah, you really need to have some water. And they do. And the fascia can be way more painful. And so with her body, Laurel's body, her body does feel quite heavy because of the restriction of the fascia. So actually all that compression affects really your organs, but affects mobility, okay? So with the assessment with everyone, maybe I can do a short video and send it if you can't see it in the replay of really a live fascial assessment. So you can tell when I'm doing this, I'm not looking at the top, so that's why I didn't see that you guys couldn't see it. So can you explain how the sides stretch as is stretching muscles and not fascia? So this is why I say fascia is an experience. So when you get the movement and it locks in, your brain locks into it, you go, okay, there's the difference between muscle, tension, and fascia. And as people start doing the movements more, and then the slow tempo. So again, when we're doing like the foot movement, so when people are flexing and pointing. So this is joint. So I go, okay, here's the tempo. 1, 2, 3, 4, and do it lying down where your hamstrings and your calves are on your bed. If you lift it up, then again, we're doing joint. And so for most people, if they do this tempo, 1, 2, 3, 4, it engages the fascia, and then back 1, 2, 3, 4. And most people who are starting this, they are dehydrated, and so they will go into spasm. So I'm like, they just need more water, they need electrolytes, and then they can start doing that. Because again, the fascia, every time you move, your body is actually utilizing water. So it's so important to the fascia, and it's so important to the muscles. So does this make sense? When not well hydrated, a massage session by a not well educated in fascia feels painful and the therapist could ease up? Yes. So that is a great question there, because with massage, people like deeper, deeper, deeper. And they are not understanding that, one, you have lymphatics, you have the fascia, less is better. Deeper is harder for the practitioner, but also for the person. They think they need to be beaten into submission to get a result for a half hour or a day. The hydration piece, yes, is so important, because then you can actually open up the fascial fibers, and then the muscles, you don't need to pound on them. So I'm teaching that for the practitioner point, but also as the person receiving, make sure you're hydrated. I have it in my intake form right away that people have to drink, if they're in Canada, 3 liters, at least a week before per day, working up to it, of course, because if you haven't been drinking that much, which is, almost a gallon of water, you'll be peeing it out, because it's like a rainstorm. If you rain in if that thunderstorm comes in the desert and it's flooding because the ground can't receive it, the same is happening inside the body. So we have to sip, we can't guzzle. Guzzling for an appointment really doesn't help, because you end up just having to go to the bathroom. So again, sipping, and it's better to start doing it a few days at least, or a week before the appointment, and then also before the appointment. Yes. Oh, awesome, thank you. Okay, so if there's any more questions, I think we are getting good for time here. Let me check. Yes. So yeah, I'll just go in here. Yeah, so really that's me. How to get a hold of me, follow me on Instagram, Facebook, or Twitter. Love to get the follow and reach out. I'm highly interactive with my community, because working with the fascia is very specific. And again, it can make the difference of lasting pain to not lasting pain. So really mobility and flexibility come within the fascia. So, and I'm gonna just check here. I would like to learn more about how to consider the role of impact on fascia versus hypermobility and ligament laxity. Yes. Okay, so yeah, there's lots of, and fascial lines mildly different in someone who has scoliosis. These are great questions. So I don't know, Dr. Emily, can I have a few more minutes to answer these?
If you wanted to take another 2 minutes.
Okay, 2 minutes, perfect. So the scoliosis one, I actually did a couple papers on that, and it's actually the fascia that is pulling the spine out. And they're now doing genetics on determining what is causing that, but it again, lines of tension in the fascia. Worked with many people with scoliosis, which is doing the fascia part to keep them really symmetrical and their scoliosis not enhancing. So again, so how to heal front shoulder pain. Oh, that's a big question. For the hip stretch, when the hip is out, is the stretch on the opposite side? Could you demo? So the hip stretch, so it's anchoring the hip. So when we have lines of tension, we just want to anchor the hip and then stretch. So if they have a line of tension leaning to this way, this is the side I would stretch. If they have no line of tension here, but they're leaning here, you want to stretch the side they're leaning to, not the side that is moving inward, okay? Because then that's just going to really increase that lean that way. I have a son who's a firefighter with a shoulder tear, can't specify, he still can't move it. What fascial professional should he pursue? So again, with the tear, we would look at maybe doing different modalities to stabilize the joint if that's necessary, but then looking for a fascial specialist who works really with lines of tension in the fascia. So somebody who does my courses, the Fascia Training Institute, are trained that way. Does rebounding have a positive effect on fascia as it does lymphatic flow? So rebounding really has 2 minutes. 2 minutes of rebounding has a positive effect on the lymphatic. Longer than that actually restricts the fascia. So that's a very interesting question, which has a lot of debate behind it, but I just want to put that in there. A gallon of water per day, where is your research on this? That I can provide, again, to you. There's lots of research on that. For our baseline, we burn approximately 1,500 calories without moving. So 1.5 liters per 1,500 calories. And again, looking at what you ingest, your activity level, altitude, alcohol intake, all that sort of thing, what food you eat, really determines your water intake. So for each person, it is different, because if they're eating a lot of food that has a high water quality in it, then they wouldn't need to. So again, each person is as unique as their fascia. All right. Because there's lots more great questions, but I think I've gone over time. And again, I appreciate you guys being here. And thank you very much for joining me tonight.
Thank you so much, Simone, and thank you to everyone who has tuned in. The recording will be sent out, and we will hopefully see you at another EBFA webinar, the course that we're doing in the winter together, and then of course at Simone's courses that she listed. So thank you all so much again, and have a wonderful day or evening wherever in the world you may be. Take care.
Thank you.